Jeremy Fry, Kansas City. Well, I think the thing that I learned from my dad very early was how important the patient was in the process, and focusing on the patient over maybe the what we were taught in school is the ideal or the ABO standard that we all have to follow or should follow. And I think that coming out of school and being a fairly idealistic orthodontist young doctor, thinking that we all know everything and that we come in and tell patients what to do. And I think that's something that I knew inherently I needed to be better at than I was when I got out of school. And I think I focus more on that now, the catering of the care to patients' needs and desires. And sometimes good enough is good enough as opposed to perfection, which is something that is hard to accept as perfectionists that we are. I also think the one thing I did take away from school is this healthy, maybe unhealthy fear of not presenting every option that existed under the sun for patients. And I think that patients come to us because they do require our expertise and at some level like us to tell them what the best option is, even if it is just between maybe two specific options of braces versus Invisalign. I think they do want to know which is best. And trying to interpret what a patient's desires are and what is the best treatment is something that I've had to learn a lot. Instead of presenting 5 different options from jaw surgery to maybe minor tooth movement with Invisalign for the same patient, hone in on, okay, surgery doesn't sound like it's going to be something this patient would ever want to do because of X, Y, and Z conversation. So maybe they are looking more at this option over the other, and maybe not needing to kind of just go through the litany of all of the very specific options that we can do. I think learning how to communicate that to patients in a way that's healthy for their treatment and also for having them trust in us, I think is very important.